Good afternoon, Stuttgart military community. My name is Colonel Jason Condrey, and I'm coming to you today, Sunday, the 22nd of March. It is now 12:30. We've got 29 positive in the community, over 270 that are either self-isolated or self-quarantined, and that number goes up with each passing phone call. I wanted to come to you and talk about some of the things that are very pressing for our community. I want you to hear directly from me, and I've taken some notes so that I don't get anything wrong. So the first thing, it's going on now, it started yesterday, is some deliberate testing of asymptomatic members of our community. So I understand there's a spike in concern across the community, whether it's something you're seeing on the news or something you're hearing about here in Stuttgart. And I know that some of the communication that I've been sharing with senior leaders has been pasted on social media for everyone to see. First, I want you to know I'm not telling any of our senior leaders anything that I'm not willing to tell you. I ask that you wait and let me tell you first. I know many of you are frustrated that you're being turned away at our testing sites. Be frustrated at me. I told our medical professionals to execute the plan we put together. Be nice to them. It's clear to me that we've been fighting the enemy's plan for several weeks now. The enemy being this virus. We've not been fast enough or disciplined enough in implementing the social distancing, the hygiene, all the things that we now know we must do to keep ourselves safe from this virus and to keep the virus isolated until it dies and runs its course. We've been chasing the positive contact. On our best day, 24 hours behind, and in some cases, many days more. We needed to find a way to jump ahead of the virus and identify those without symptoms that were unknowingly spreading the virus. We've had a change in how we do testing that makes this possible. But even with that change, we don't have enough test kits to test everyone. We have about 28,000 in our community, and I have no doubt we would find about 28,000 volunteers to sign up to figure out if they have COVID-19. Many of you are sitting in a car or standing in a line right now, but you are not the person I am looking for. In order to jump ahead of the virus, we need to look in every workspace, in every stairwell apartment within our family housing, and look at our workforce in some of those critical high contact services, our hotel staff, our cashiers, all of those people that you see day in and day out that interact with you. I want to make sure we check them as well. I want to find the people and places today that we would otherwise find 3 to 7 days from now when people start showing symptoms. That's what we're doing right now. This is possible only because of a recent change in how we collect and transport test swabs. The new limiting factor now becomes how quickly those tests can be processed at Landstuhl. And so because of that, we must pace our testing with that testing capacity. This change has also occurred since many of you came through screening and because of symptoms were told to go home. If you have symptoms, you're not the person we're looking for. Our expectation is that you are staying at home. We're working with units across the installation to find the right people, help us see the entire installation, every workspace, every high contact service area, every stairwell in each one of our apartment buildings. The reality is that this will be just one snapshot in time. And the moment you get tested, an hour later, you could have contact with the virus and then be spreading it. Ultimately, isolation, quarantine, and disciplined social distancing are the only things that are going to allow us to prevail. So if you have not been asked to go get tested, to volunteer to test today, please stay home. If you're concerned about the symptoms that you have, the Patch Drive-Thru Clinic is still open for that screening. The planned hours are 10 to 16:30 today, and I will tell you that if there are changes to those hours, we will post them via the app, social media, as many ways as we can to get the word out to you. If you have been asked to get tested as one of the asymptomatic test members, that testing will occur at the PX on Panzer. The planned hours are 12 today till about 4 o'clock, but as soon as we run out of samples, we are done testing for the day. I want to talk about self-quarantine and self-isolation. There's a lot of questions out there about what those terms mean. What do I need to do? I'm going to hit some highlights. You must self-isolate for 14 days if you have tested positive. Stay in your home. If you live with someone that tested positive, presume you are also positive and self-quarantine. Stay at home. If you have persistent contact with someone that tested positive, at work for example, presume you are positive and self-quarantine. Stay at home. If on day 5 of your family member's self-isolation you develop symptoms, your family's 14-day clock has started over. Stay at home. A negative test for someone that is self-isolated or self-quarantined does not release them from the 14-day window. You could have the virus in your system and it not have enough to present as a positive test. The very next day, you may begin showing symptoms. Stay at home. Please understand how this virus works. Educate yourself. Please stay at home if you are quarantined or isolated. Now, there are some exceptions to that. There may be a reason why you need to leave. And the most pressing ones are if you need to go to a doctor, go to the hospital, and for those of you that have pets. So if you are COVID-19 positive, the only reason you should leave your home is if a doctor has directed you to do so or you need to go to an emergency room. For pet owners, after speaking with our public health experts, there is less risk with a self-quarantined person taking their own dog outside than trying to have a neighbor take their dog. That presumes that as you go outside, you are deliberately cleaning handrails, deliberately cleaning doorknobs, and you have put some sort of makeshift mask over your face to ensure that if you cough or sneeze, it doesn't go any further than your face. The reality is your neighbor coming to get your dog to take them out could get contact with the virus just by petting the dog on the head, touching the collar, or touching the leash. We want to avoid that. So there are some rules. If you take your dog out, stay within 500 feet of where you live. Stay outside no more than 15 minutes. And double your social distancing from 6 feet to 12 whenever you see someone in your stairwell or outside. Go out, make sure your dog takes care of their business, and come back in, and then stay at home. The state of Baden-Württemberg has implemented some new measures. They were effective yesterday. Here's what they are. So there's a closure of restaurants. There will only be takeout options available. The hours have been reduced as well. There is a prohibition on assemblies and gatherings of no more than 3 people in public spaces. There are exceptions for families and people that live together. I'm not sure how you will justify those exceptions. There are entry restrictions to Baden-Württemberg from people coming from other corona risk areas. We're looking to find out what those other areas are. And all of the hairdressers and barbers have been closed. Right now, today, we are working with our partners outside the wire to understand how they will implement and enforce those new measures. I have mirrored their directive with a garrison policy, an order that is required in order for us to meet our obligations within our SOFA agreement. I know you need to get to work and may even need to get groceries from the store down the street. If you're a service member, I'm asking you to wear your uniform to and from work. Not to the grocery store, but to and from work. If you're a mission-critical civilian, whether you work in the commissary, hotel, food service, PX, or in a secure space at one of our 2 combatant commands, we are refining the details on how you can communicate that to German authorities. Stay tuned. I want to talk about hotel relocations. So across Stuttgart, hotels are closing because they don't have enough people in them to keep staffing them. We still have many of our inbound and outbound families and service members and civilians out in those hotels. We've been trying to contact them and ask them to relocate to 1, the Marriott Sindelfingen. Don't try and make online reservations. I'm asking you to call them and arrange to relocate to the Marriott Sindelfingen. The number will be below this video. Commissary, AFES, the food court. It is time to stop bringing your family members to those locations. Now I realize some of you have small children, your spouses are at work, you have no other option. In that case, bring your children. Ensure hands stay in pockets or inside the carts. The minimization of contact with as few hands as possible is going to be critical to ensure that we don't spread this virus any further. The next COVID-19 town hall is going to be 2:30 on Monday. It's going to be with our school kids. I'll be here with our superintendent, and we're going to answer questions about COVID, new virtual schooling, anything they want. I hope you'll tune in. And that reminds me, from 8 to 2:30 every day, there's school going on. Everyone's familiar with how limited bandwidth is here within Germany, here within our area. Do not break the internet. Save your streaming of whatever season of The Walking Dead until school is over. So I'm confident we will prevail over this virus. I'm asking that you be part of the solution for your family, for your neighbor, for your coworker. We're going to learn our way through this. Let us know where you see our gaps and seams, and we'll work to quickly fix them. Thanks for your time and your patience.